Me too. I'm excited we're finally meeting with a genetic counselor to discuss our options.
When I spoke with the woman on the phone, she said that they were going to do genetic counseling and they were going to ask us about our family history.
Hi, I'm going to be your nurse today.
Hi, I'm Bianca.
I'm John.
How are you two doing?
Good.
Good.
So, do you want to tell me a little bit about why you're here?
Well, we both always wanted to be parents and we feel like we're at a point in our lives where we're comfortable starting a family.
I've always wanted a son that I can go fishing with.
Great. So I'm going to ask you a few questions to ensure that your pregnancy is as healthy as possible. I'll start off with Bianca. How old are you?
I'm 36 years old, so because I'm a little bit older, is that going to put me in more risks for complications during the pregnancy?
Yes, there are a few potential complications that may be associated with later pregnancies. You may experience infertility, low birth weight, chromosomal defects such as Down syndrome, or possibly a miscarriage.
Does that mean we'll have trouble getting pregnant or even staying pregnant?
Healthy women in their 30s have around the same risk of complications as women in their 20s. So as long as you're healthy and remain so during pregnancy, there really should be no worries.
Good. You scared me there for a minute. I thought I was going to be on my fishing buddy.
Do either of you know of any genetic diseases that run in your families?
None that I know of.
I don't know if this counts, but I may be a carrier for sickle cell anemia, and my brother has the disease.
So, sickle cell anemia is one of the diseases I was going to bring up with you two, since you're African American and are more susceptible to the disease. Bianca, if you're not a carrier, there's no chance the baby will have the disorder. However, if you are a carrier, there's a 50% chance the baby will be a carrier as well.
Nobody in my family has that disease that I know of.
It's good, because I know watching my brother grow up with the disease has been a struggle for him, and I'm glad our child won't have to deal with that.
Are there any other genetic diseases either of you know of that run in your families?
No.
Nope.
Bianca, do you smoke at all?
Yeah, I smoke about a half a pack a day.
Do you drink at all?
Usually about 2 to 4 glasses of wine a week.
You guys, unfortunately, I was held with another couple. How are you?
Hi, I'm Bianca.
I'm John.
Nice to meet you.
We were just discussing some of the possible teratogenic things that Bianca may have been exposed to.
What's a teratogenic?
A teratogen is something that's found in the environment that could harm the baby during the prenatal period. So like examples of those would be smoking and drinking.
I do both of those. Should I be worried?
Unfortunately, those are two things that can and will harm the baby. Since you're currently a smoker, I would suggest chewing gum or sucking in a lollipop when you get the urge to smoke would definitely help you.
I'll do anything I can to help you. I'll even not drink during the pregnancy so it's easier for you.
Smoking can lead to low birth weight and a cleft lip, and alcohol can lead to a slower growth rate, especially as the child grows up, and both can lead to cognitive issues.
With alcohol, we worry about fetal alcohol syndrome.
So fetal alcohol syndrome is behavioral, mental, and can lead to physical problems as well, and can cause facial distinctions and cognitive issues.
I definitely want to do anything and everything I can to quit smoking and drinking as soon as possible.
Unfortunately, I have to go meet with another couple, but I do have a pamphlet on prenatal diagnostics testing, and the nurse is going to go over your options a little bit more in depth with you, okay? It was nice meeting you guys.
Thank you.
Prenatal diagnostic testing methods include ultrasound, amniocentesis, fetoscopy, and many others.
Would you mind going over the most popular of those options with us?
Sure. So amniocentesis is the most widely used technique, and it involves a hollow needle being inserted into the abdominal wall in order to obtain a sample of fluid from the uterus.
And what will that test tell us?
It's a way to test the cells for any genetic defects.
And what about ultrasounds? I think I've had one of those before.
So ultrasounds basically give us a faint image of the baby that allows us to detect some, but not all defects, and we can also determine the gender of the baby with ultrasounds.
Is there anything else that we should be aware of?
I'm definitely going to recommend that you start putting more folic acid into your diet as soon as possible, as that helps with neural tube development, and lack of folic acid can lead to anencephaly or spina bifida. You can easily buy folic acid supplements at your grocery store.
Okay, I'll definitely make sure to go out and buy those as soon as possible and start taking them.
I want to make sure that you're taking in the recommended intake of fruits and vegetables, and remember that everything you consume, your baby does too. Make sure that you eat enough so that your baby's born with a healthy birth weight.
Okay, I'll make sure to keep a healthy diet.
Do you have any other questions right now?
How long should we wait before trying to get pregnant?
Well, as soon as your smoking and drinking habits have ended and you feel that your health is well, you can try to conceive whenever you're ready.
Can't wait to get my fishing buddy on the way.
Thank you so much for everything that you've given us today. You've given us so much helpful advice and so much to consider.
No problem. Feel free to call the office with any other questions, and good luck with your pregnancy.
Thank you.
Thank you.